Hi, my name is Sabrina. I'm here to present a case called exogenous lipoid pneumonia associated with oil-based topical oil and nasal products. So this was a case I saw of a non-resolving pneumonia, which has been defined as pneumonia with absence of clinical improvement. There's clinical worsening or absence of radiographic resolution within 12 weeks of adequate antibiotic therapy. While exogenous lipoid pneumonia is a rare cause of non-resolving pneumonia, which is the aspiration of an oil-based or fatty product. So this was a 30-year-old male who presented with shortness of breath, night sweats, and fatigue. He had a past medical history of irritable bowel syndrome, recurrent sinusitis, remote tonsillectomy, and anxiety. He had pneumonia diagnosed back when he was in Poland, which was seen on chest X-ray and CT scan. We don't have the original radiographs, but here in Figure 1 and 2, this was done when we saw him. You can see opacities and consolidation. After this, he was treated with clarithromycin, and he was returned back to Canada. However, due to unresolving symptoms, he presented to the emergency department multiple times and had repeat imaging done. He was then prescribed another course of amoxicillin, and eventually his results of a BAL done in Poland was available to us, and he was shown to have Pseudomonas aeruginosa and Serratia marcescens. After that, he was prescribed ciprofloxacin. However, his symptoms had still not resolved, and as you can see, his blood work in Table 2 was unremarkable besides a mild normocytic anemia. His connective tissue disease workup was unremarkable. He had a repeat BAL done with us, and that was also unremarkable. Eventually, he underwent a CT-guided lung biopsy, and the pathology results showed that he had a amorphous acellular substance with a foreign body giant cell reaction, but further identification was not possible, and you can see this in Figure 3. So this prompted us to take a further exposure history, which he disclosed that he has been swishing and spitting flaxseed oil, and also using a oil nasal decongestant. So given his exposure history and consistency with the pathology results, he was diagnosed with an exogenous lipoid pneumonia. He was counseled to discontinue the antibiotics and the oil products. He was reassessed 3 months later and was reported to be feeling better, but still had dyspnea on exertion. His PFT testing on Table 1 here showed improvements in his lung volumes. So overall, exogenous lipoid pneumonia may present with a superimposed bacterial infection, which is what we think was happening in this patient. Our case highlights the differential diagnosis of a non-resolved pneumonia is presented here in box 1. Our case highlights the importance of taking a detailed exposure history, including exposure to a fatty oily substance, especially in these cases for a thorough workup of non-resolving pneumonia. Thank you.